and the amount they are charging for medical equipment. And the insurance company says, I can raise my premiums and say that they are raising their rates. It's still the case that the insurance company can invest a larger amount of money because the money isn't used up until somebody gets sick, and they get greater profits that way. All right, so this is very different from a situation where you have say a manufacturer of automobiles, a salesman, and that situation is not really comparable to this particular situation, where you get a coincidence of interest between the insurers and the providers. Now, what's driving that coincidence of interest? What is driving it is the profit motive. If you take the profit out of it, there is no motivation for the insurers to want to get more money out of the providers, and if that's the case, the providers will just have to sit on their desire to get more money. Okay, now this argument, I think, makes it clear that if you're trying to reform the system, you don't want to do it with for-profit insurance. That will only lead to increases in premiums, a hyperinflation. You've all seen the graph which shows how wages have risen, how the cost of living has risen, and how premiums have risen. Premiums has a much steeper slope than either of the other curves. They're going up a lot faster. This is, I call it hyperinflation because it is out of line with the inflation in the other areas. So when we go back to talking about Switzerland or Japan or Germany, nobody is saying they have bad healthcare systems. Their outcomes are better than U.S. outcomes by far. The one thing they have in common is they have private, private, not-for-profit insurance. Now, you can go to other countries and see that they have public, not-for-profit insurance, like France, for example, or Taiwan, or Canada. That's another different situation. But all I'm trying to show is that this persistence in feeling that we can use the profit motive in healthcare is the death of our healthcare system. It is never going to be stopped. We're never going to get that controlled. And if you say, well, we can control it by putting a lid on the amount of premiums these companies can cost, they're going to say, that's not the game we want to play. We really want to be profit-making institutions who make as much profit as we want. Otherwise, if you do that, then we'll put our capital somewhere else and the whole system will collapse. Okay, now let me finish up with something much more concrete. Giving you several speculative ideas about public goods and about corporatist democracy, and now about why profit systems don't work in healthcare. I'm not saying they don't work anywhere else. I'm just saying in healthcare they don't work. What do we do the day after Obama signs a healthcare bill that has been distorted in many ways by the corporatist elements in the society? Well, even before we get to that, I think there are some things we should be thinking about doing. One is, Nancy Pelosi, as you know, promised Anthony Weiner, representative of New York, that there would be a full hearing and a vote on the single-payer bill in the House. This would be a historic event. It would be great. First time that this has happened in the U.S. Congress. You should all get in touch with Nancy Pelosi and say, stick to your pledge to Anthony Weiner and make sure that we do have that vote before we have a vote on the House bill. The second thing is, Dennis Kucinich has, your Ohio representative, has introduced as an amendment to the House bill as it was worked on in the House, not the Weiner single-payer bill. He has introduced a bill that would say that single-payer plans can be adopted by the states. If that is passed, then the old regulations under ERISA, don't ask me what that acronym is, I always forget it. ERISA means that the federal government predominates in terms of changing any laws that have been set up under Taft-Hartley rules. If that's the case, then if you try to introduce single payer, you're in a state like Ohio, you are getting yourself in trouble with ERISA. Kucinich would just wipe that out, and it's very important that if that House bill goes up, that that's kept in the Senate and that Obama signs that. The third is Bernie Sanders of Vermont, the senator, has introduced a bill 703 that you should contact your senators and ask him to support. But then the question I have, and I think the question many of us have, is if you're writing your representative or your senator, what do you tell them? You tell them to vote for the bills that are being fashioned in the House and in the Senate now or not. This is the existential question that we face. There are plenty of things to like about the kind of legislation that will be coming forward. We certainly want there to be fewer uninsured people. We certainly want quality in Medicare to be a criterion rather than simply the number of MRIs or whatever a doctor wants to perform. We want outcomes to be the test in Medicare. We want to extend Medicaid to 130% of poverty. We want to make employer self-insured plans subject to the same regulations that insurance plans, where the underwriting is by the insurer, have. Those are all very positive things, and if we took them out one by one, we would encourage anybody to vote on those things. But there are negatives associated with those bills, and we have to look them straight in the face. There will be the hyperinflation because it is a for-profit, it's going to be a for-profit based system. Made even worse by the fact that we're introducing millions more uninsured to the insurance companies to be their members to pay their premiums. And there will be no reduction in the insurance company's overhead. This is one of the things that we complain about a lot.